Welcome to the Safety Net, Brookline Interactive Group's cable TV show devoted to domestic violence. But during COVID, we have expanded the issues that we currently discuss on the show. Today, we are going to talk about domestic violence. I'm Susan Howards, a local Brookline attorney, a family violence attorney. And with me today, I am thrilled because it took a long time, is Toni Troop, director of Jane Doe, Susan Ross, director of Second Step in Newton, and Dawn of ATASK, the Asian Task Force on Domestic Violence. Welcome to all of you.
Thank you.
Toni, I'm going to start with you. Could you tell us a little bit about yourself?
So, Susan, let me just start by saying you and I met a few decades ago. And we won't count exactly. So I'm just thrilled to be here again talking about these issues and want to thank you for constantly raising these issues in the community and helping to shine a light on them. Because one thing we know for sure is that domestic violence and sexual assault thrive in silence. And we just can't thank you enough for inviting us here. I'm Toni Troop. I'm the Director of Communications and Development at Jane Doe Inc. Been there for about 22 years. And I came here after being at Rosie's Place and a few other political activities that, kind of preceded that. And I'm just delighted to be here with two of our Jane Doe member programs. And I'll pass it on to them to introduce themselves.
Okay, Sue, you're next. Sue Ross of Second Step in Newton.
Great. Thank you, Sue. It's really nice to be here as a Brookline resident and a longtime friend and colleague of yours. I am the executive director of the Second Step. I've been in that role for about a little more than a year. Prior to that, I was running the free legal services program at the Second Step called Steps to Justice. I am an attorney by training and background, and I started my career in the domestic violence unit of the Middlesex District Attorney's Office. And, this is a cause that I am really committed to and that I care about a lot and that I've, I'm invested in finding solutions for and talking about raising awareness and helping people who are suffering.
Great. Thanks, Sue. And Dawn, would you introduce yourself?
Hi, thank you for having me. Dawn Sauma. I am the co-executive director of the Asian Task Force Against Domestic Violence. I started working in mental health and healthcare about probably 28 years ago and have been at ATASK for, I think, about 11 years now. I am originally from Hawaii. So bring my sort of multicultural and biracial Japanese and white and bring that with me.
Wow.
One more thing. Sorry. I am also the president-elect of Jane Doe Inc. And I want to put that out there. Shout out to JDI.
Oh, my good. It's good.
Congratulations.
Then Congratulations. Toni, I'm going to start with you. What's the most important thing you want viewers in Brookline to know on this topic?
Right. There's three things that really come to mind. The first is letting people know that they are not alone. Domestic and sexual violence impacts everybody in all communities. And so often it just breaks my heart when we hear people say, well, I didn't know where to turn. We want to let people know that there are places, programs, trained advocates who are there that they can talk to. We also want to let people know that everybody has a role to play because this, again, issue affects all of us and it happens everywhere. So no matter if you're a teacher or a police officer or an attorney or a social worker or a family member or a grandmother, there's a role that everybody can play. And really, I guess the third is that prevention is possible. We often hear people say, how do you keep doing this work? It must be exhausting. It just never, it doesn't seem to ever go away. And the reality is it is quite pervasive. And we can talk about that later. But we also want to let people know that prevention is possible. We have a lot of hope in this field. I don't think all of us could show up every single day to do this work if we didn't have some hope.
And if we didn't have each other. I know
Absolutely.
As a family violence attorney, I rely on people like all of you for support. I'm not sure I'm as hopeful as you all are. Maybe it's because I've been doing it longer. Sue, do you want to build on what Toni has said?
I do. I agree absolutely with what Toni has said. I want people to know that we believe you. Sometimes it can be hard to come forward with a story because everybody knows the abuser and he or she is so nice, so attractive, funny, kind, have a good job. And no one would ever believe that they are capable of doing the things that are happening to you. But we believe survivors. And I think that's really important to know. If you tell us your story, it is safe with us and we will believe you and we can help. There are resources and programs. And what I really want people to know is that you can heal and that you can have a safe, prosperous future. This is not your whole story. And, there are people and communities to help you get to the next chapter.
And Sue, domestic violence is more than just physical violence, isn't it?
It is. Everyone, often thinks that it's just physical, but it can be emotional, psychological, financial, sexual abuse. And very often our clients tell us that it's easier to heal from cuts and bruises than it is from the emotional damage caused, the things we don't see, and they struggle alone.
Dawn, do you want to add to what Sue and Toni have said?
Yeah. And I definitely want to echo the "you are not alone" component, because we work with a hyper marginalized population, and A-Task was designed and built so that Asian, limited English proficient, who are often immigrants and refugees, first generation, don't feel that they're alone, because often that they are. And another point that I want to make is that we're not often the first point of contact. It's through shows like this. It's through community members knowing that we exist as a service, because somebody in the community, a friend, a family member, a provider, will know somebody who is in need of help, or somebody else themselves needs help. And then they reach out to us. We often get referrals even from clients, former clients, who is spreading the word through the community. So it's important that the messaging gets out there, and the community members know that they are that first point of contact, and that's super important.
Right. We've come a long way in raising awareness since I started in this field with the Framingham 8 almost 30 years ago. But people ask all the time, what? There's domestic violence in my community? No, there's no domestic violence in Brookline. There's no domestic violence in Newton. How do you respond to that, Toni?
It's one of the biggest misconceptions, and it actually is often what makes people not reach out, because they think that they're the only one, right? It's about them, and it's not a societal issue. Domestic violence and sexual violence, they are acts of an individual, kind of an individual act, but it happens in the context of a societal issue that dehumanizes people. It says it's okay to exert power and control over somebody else, and not exclusively against women. We know that women are more vulnerable because of our societal norms and the gender norms that we have, but it also means that people who identify as LGBTQ are more at risk. Limited English proficiency, individuals might be more at risk because they're more isolated. That domestic violence is, as Sue was saying earlier, it's physical, it's emotional, it's sexual, it's financial. There are all of those tools. And so you might be in a more affluent community, but it doesn't mean that the emotional abuse isn't there. Or you might be somebody of limited income living in a more affluent community and feel like you're never seen, right? So there are all of these misconceptions there, and it happens everywhere. It happens to everyone, and across the lifespan as well.
What do you mean across the lifespan? You mean even into the senior years?
Yes, absolutely. I don't know, Sue, if you were one of you going to speak to that?
I think I was. So it absolutely what Toni said. We see all the time that it is all races, genders, socioeconomics, and ages. And whether it is teen dating violence, and there is more of that than anyone thinks. Again, can be little things that, a boyfriend who wants to know where his girlfriend is all the time, or has something to say about what she's wearing at the time, might feel like it's, a lot of attention and it feels really good. But in fact, can be the beginning of what is, a pattern of coercion and control. And we see it in married people, single people, and elders. We had a client recently who was 72, had been married for 50 years, and was finally in a place where she needed help and wanted help, and we were able to do that for her. So it really does extend through the through the lifespan. And even, I think often, or it used to be, that children were seen as kind of secondary victims if they were present when domestic violence was occurring. But what we know now is that they're primary victims, and they are traumatized just like the adults who might be, the direct recipient of the abuse. But it really affects the whole person, the whole family, and, as Toni said, the community. I recently saw a statistic that nationally, there were 8 million paid workdays missed because of somebody suffering from domestic violence at a cost of $8 billion. So it's everywhere, and it's affecting all of us, even if we don't think it is.
And basically, it's 1 in 4 women, am I correct, who are victims? I still use the word victim, mainly because I'm in court and judges sort of respond to that word a little more than they do the other words. 1 in 4 women are victims of domestic violence. Not to say that there aren't men or trans or other groups that aren't also involved in this unfortunate experience. Dawn, what does it look like in culturally specific communities that you serve?
So that's a good question. And so I'm honing in on a word that you said, prevalent. And how do we define prevalent? I mean, that's based on data. And so a lot of the community that we serve often doesn't show up in the data. And there are a variety of reasons for that. Underreporting, not reporting, culture. There are cultural factors as well. In Asian culture, domestic violence, sexual assault, it's a private matter. It's something that you don't talk about in the community. And when you do, there's a shaming that comes with that. It's almost a community shaming that can also happen. We've had situations where we've had interpreters shaming the victim for even talking about this openly. And so there are real reasons that this doesn't get reported in the communities. And a lot of times we'll have survivors who they don't want to get involved with the legal system or the law enforcement. They just want it to go away quietly because they're worried about consequences. So they'd rather not get involved because there are other severe consequences that they're thinking about at the same time. Another reason that it doesn't show up are the language barriers. And so if you don't know where to seek help, you can't get help. And so that's another barrier. And so we serve over 500 households annually. That's a lot. Like that's 1,200, but you're not going to see those numbers show up. So the 1 in 4, I don't even know how accurate that is. It could be a lot more than that. So it's hard to put a number on, but what I can say is that it's most likely a lot higher than what we think it is.
I agree with you. And I have found with recently too, of clients coming to my office, they come forward, but as we were talking before we went on air, they don't want to go forward. They don't want to get the restraining order, even though they know that it might help. They're afraid, or for some reason, whatever it is, they'll come to the office, they'll listen and they say, no, I can't, and they'll leave. And
That's
to
right.
follow up is really hard as an attorney because you don't want to be pushy, at least I don't. I believe that a victim makes up his or her own mind. I have a real issue with anybody telling any victim what to do. But I also feel that as an attorney, it's my responsibility to lay out all the options, to give them a roadmap, and then it's up to you. Even if it means that I know that the person is going home to a really horrific, violent, serious situation. And the one thing that I found, and maybe you have, Sue and Toni, is when I tell them that their children are victims of it could be taken from them by DCF, that's the one thing that gets their attention. Is the thought of, and maybe that will not push them, but urge them to get some help. But it's really, really hard, especially during COVID.
Can I pick up on that for a second?
Yeah, please.
Which is
pick up on anything. Absolutely.
No, that's fine. So, when we talk about domestic violence and sexual violence happening in every community, it is really important to couch that in saying also that it doesn't impact every community in the same way or equally. And because of some of the barriers that we've identified, it makes people both more vulnerable because they can't access the services, and the person who's abusing them knows that and can use that as a tool to keep people from reaching out for the help that they need. And when you mention things like the child welfare system, to our mind, it is one of those systems that could be a real help, but it can also be very punitive for victims of domestic violence. And similarly to law enforcement, Some folks will find it very helpful. They're physically in danger and they decide this is the call that they want to make. And for others, they choose not to engage in that system because of the disparate experience, specifically that Black victims, people of color, immigrants, LGBTQ, and other marginalized communities are going to experience. So when we talk about it, we just want to be mindful that these systems need to also understand the reasons why somebody might not engage with them, and what we can do to help make those systems more responsive, but also think about alternatives, because those systems are not going to work for everyone.
That's true. And they also, I think we have to respect the decision of the individual. That's where I'm coming from. I will respect whatever you decide. I may not agree with it. It may put you and your kids in further danger. I've explained that, but it is your choice. And I'm really, there's one new judge on the bench, I'm not going to say which county, who's really, really tough on domestic violence. And he sends out a capias for the victims who don't come in and don't want to testify. I had a scream out. I was told, I'm going to lock you up, counselor. I said, fine, give me my one phone call. I don't care. But it's wrong. You don't send out a capias to somebody who's already capias up the kazoo, quite frankly. You just don't do that. And this judge just doesn't get it. He thinks he's being tough on domestic violence. And I don't understand it. I don't understand the training that the judges get. I know they're getting training, so I can't beat that, but they're not getting the right kind of training, if you want my opinion. Anyway.
Hey, Susan, can I just hone in?
Absolutely. Jump in.
Toni mentioned it, and it was about messaging. And so one of the things that we're hearing a lot about and know is messaging that perpetrators are giving to the victims to keep them into the situation that they are. And oftentimes that messaging is, and particularly in response to the limited English population, is that nobody's going to understand you, nobody's going to listen to you, and you won't get any help. And the thing is that they're absolutely not wrong. They're constantly re-victimized by the system. And to your point, Susan, that's exactly what we're talking about. And it's not just within the court system, it's within many different systems. But that's happening repeatedly. So there are reasons that people don't want to go through this and they want to stop. It's just not worth it. I'd rather just have a safe home. I want to get out of this situation and I want to figure out how I'm going to stabilize.
But how do they have a safe home, Dawn? How do they get out of the situation? We need, at least I need the resources as an attorney. I need help. I can't do it alone. I can fight with judges. I can fight with advocates. I can fight with probation. I can do all of that, but it's not necessarily going to be effective. Sue, maybe you want to jump in on this, because I need the help of everybody, of you, of Toni, of Sue, of the police, of social workers. I need it all.
Yeah. Well, so I think one thing that I wanted to say is that, we know that it takes sometimes up to 7 tries to leave. Right. And so if somebody's listening today and they're feeling like they're afraid to leave, that doesn't mean that they're always going to feel that way. And the fear is real. I mean, we know from research that the time that you change the dynamic of a relationship by regaining some power and control, and that can be by leaving, can be the most dangerous time. So people are experiencing this. They're the experts in their lives. They have the instincts that they should trust. But that's where, every time they get to that point where they think they're going to leave, the next time, maybe they're going to be closer. And, whether it's realizing that they need to protect their children or that they just can't take it one more time, or maybe they finally found the resources to help them with a safety plan, to help them with housing, to help them with all those supports. Now they can, they have more, internal resources and external resources. And that's something, that the second step does. And I know that ATASK does as well. We have, for example, lawyers who can represent clients, but then we also have the wraparound comprehensive services to support the whole person and the rest of their lives. And so change and leaving is possible because they have that support in conjunction with the legal system or the police.
Right. Toni, can you tell us a little bit about Jane Doe?
Sure. So Jane Doe is the statewide coalition. We're the only statewide coalition here in Massachusetts. We have coalitions like ours in every state and territory around the country. And so we sit at a really unique place in that we've got a view and kind of a network through our 60 member programs who help us keep our ear to the ground in terms of what are some of these systemic issues that need to be addressed, whether it's language access or maybe more judicial training. We then take that and turn it into our policy and advocacy agenda. So we might be advocating for legal reforms. We might be advocating and working more internally with a department or a government agency. We then also have a whole series of like another plank of our work, which is around education and membership development. So we work with our member programs and a lot of other providers and folks in the community to bring the most current best practices to everybody, and also just to learn from one another. Because just like the programs know that survivors know best what they need, we know that the advocates in the local programs, they know what's working and what's not. And so, those of us sitting at Jane Doe, we can't know it all. So we often bring all of our member programs together so they can learn from one another and really reinforce this work. And then we have another plank, which is around prevention and education. And we have a statewide campaign called the Reimagine Manhood campaign to really engage more men and boys in the work to be part of the solution. And also to really hone in on the intersection of racial justice and gender equity, and how those two, if we can marry those two together, we see such possibility to change the dynamics that contribute to violence. Those are just a few of the things that we
Wow. And Sue, what about Second Step? Can you tell us a little bit about Second Step?
I can. I just want to say that as a member organization, we value what Jane Doe does for us. To have a coalition that is listening and responding, supporting, advocating, so that we have what we need to, to be on the ground doing the work is really invaluable. The Second Step has 3 main programs. We operate a transitional living program, and that is a safe place to live for up to 2 years for singles or families, and we accept people of all genders. And while people are in our residence, they are offered services, wraparound comprehensive services around legal help getting, whether it's maybe language or job training or employment or education, so that they can be self-sustaining. We help find permanent housing with vouchers and access rapid rehousing funds, sort of a housing first model. We have a free legal services program called Steps to Justice that does restraining orders, family law, immigration, and housing. And then we have a community services program for people who are living in the community and need help with safety planning, job skills, language skills, support groups, and building the confidence and the life skills that people need to be safe and independent.
Wow. And Dawn, A-Task, I'm sure you sort of piggyback and do some of the same things that Sue and Toni do, but I think you do other things also.
We do. I guess we're just a little bit of a different design, where A-Task is a culturally and linguistically specific organization. So, and there are a handful of those throughout Massachusetts that serve the state, and often we serve a specific population rather than a region. So our staffing structure, our programs, our practices are specifically designed to respond to the Asian population. That's a marginalized population that we serve, and often underserved within the mainstream. And so we also partner, though, with mainstream organizations and other organizations to ensure that they receive comprehensive wraparound services. And often our staff act as sort of cultural and linguistic brokers. And so who they are and who we hire is incredibly important to us being able to be successful in the work, in the services that we provide. So our staff represent, particularly our frontline staff, represent the population that we serve. They are bilingual or multilingual. Their first language is often not English, and a lot of times they've learned it in the States. They're first generation immigrants and refugees. They've also survived war themselves. They're also survivors themselves. So they're also really embedded into their cultures and their communities. And so that's incredibly important for us to be able to reach and be able to gain, be that trusting support service and the new community that sometimes they're often have to leave behind.
Wow, I have one question that is not on the agenda. How has COVID impacted each of you and your organizations? We've talked about loneliness. We've talked about isolation. I know from my practice that it's been exacerbated. I mean, I was telling clients, well, you don't have a phone, you're not going to work. You do the shopping, take a little note and give it to the clerk at Stop and Shop on Harvard Street. Take a little note and give it to Trader Joe's clerk, and they will get you the resources, or they can call me. How has it affected you, Dawn, at ATask?
So on one side, we've seen that, like you've mentioned, people just haven't been able to get help. And a lot of the clients that we serve work in the service industry, which either customers aren't coming in, so it's just, there's not enough work. And so they're finding it hard to meet their day-to-day living needs. And so at the heat of the pandemic, we were probably issuing about $15,000 to $20,000 per month in client funds.
Wow.
Just to keep people have their homes, because they weren't able to avail of the moratorium on evictions. Our clients are often exploited by not only their employees, but also their landlords. They're not gonna leave. If they need to pay up, they're gonna pay up. That's it. And if they're asked to leave, they're going to leave. They're not going to take that to court because they're worried about what's going to happen if they do. And so they had no other choice often to just deal with it. And so that meant us figuring out ways to keep them stable. That's one thing. The other thing I said, the positive thing, is that we've learned how to pivot too. Everything having to go remote meant we had to go remote and figure it out. And so we're really good at it. It's helped us to reach the entire state as a statewide provider and beyond that. And staff have gotten very proficient at using Zoom and DocuSign and whatever else we have to figure out in order to make it work. So good sides and bad sides.
Okay, Sue, how has COVID affected Second Step?
Very similarly. I'm very happy to say that in our 2 transitional residences, we did not have any outbreak of COVID. We did a great job with education and hygiene and keeping everyone safe. And that was, really thanks to our staff.
Huge. Yeah.
That was huge. And, and like Dawn, we pivoted. We started doing a lot of things more remotely. We gave out a lot of food cards. And again, we did some of the things that, we had a lot of calls sounds like you did, Sue, where, somebody would call only while their husband was out walking the dog.
Exactly.
And then the phone call would end right away. And so we had to be flexible about taking calls, maybe not during office hours. And, we just really responding to what was needed at the time. We're also hanging on to some of those things now. So for people who, have trouble with childcare or don't have access to easy transportation, we're holding remote support groups, and we can provide that now to people all across the state, not just in the Metro West area. And it can be much more convenient and less expensive for people to do that. So some of the, trying to find some of the silver linings that we can hang on to some efficiencies.
Yeah. And Toni.
Yeah, I would chime in with 2 things. One is, when the pandemic first appeared and the messaging was social distancing, we got very nervous about that messaging. And what we tried to focus on was physical distancing, but social connection. Because we know, as I said in the very beginning, that the isolation actually makes people more vulnerable, puts them more at risk. So we tried to change that language. It was very difficult, us little Sisyphus, right, pushing up the hill. But we just think that that's an important differentiation. And it points to, and one other thing, which is many of the communities who are most marginalized already, like if you think about the disabled community, they had already in some ways figured out how to provide remote care, how to, provide care in a way that didn't require people traveling all the time.
Right.
And so I use those 2 as examples of things that if we started any of our policies and any of our practices by thinking about how is this going to impact the most marginalized, we would have figured some of this out even before COVID. Right. And it's a shame that it's on so many levels, right? The numbers of lives lost and impacted from COVID. But one lesson is, for me, let's not forget that lesson. Let's think about always what is going to be in the best interest of the most marginalized, because then it will actually help everyone and not further marginalize those who are already at most at risk. At Jane Doe, we're a statewide organization. We have, I think, 8 different convenings, and then a membership call, and this event and that event. On any given week, there's three meetings, and people were traveling 2 hours to a meeting for a 2-hour meeting and 2 hours back, and it was hard. It was expensive. People had to pay for transportation and time. You may have had to have somebody cover their shift while they were, coming to a meeting. When we went to remote for all of these meetings, participation increased.
Sure.
And connections increased. And one thing we saw for sure amongst all the directors, because we were meeting weekly for the first, 5 months, 6 months or so. And then we went to every other week, and now it's back to once a month. But relationships formed in that intense period of also just being with each other and getting to know each other. So we want to hold on to that. We are ready to give up other things. We're going to have our first, if things continue to go well, our first indoor event in June, and
June 14th, right? Let's push it.
But it's nerve-wracking, right? Because our biggest thing is we want people to be safe and to make the choices that feel right to them. Just the way we would work with a survivor, that's how we feel about working with our advocates, meeting with donors, supporters, and anyone else.
I think everybody is very nervous about indoor events, although I see more and more of them happening, because you don't want to be the one where, COVID outbreak, a super spreader. And there's no way of knowing. You can only do what you can do. And that's my new attitude. I go to the courts. I was in a court a couple of weeks ago, small court, shoulder to shoulder, shoulder to shoulder. No masks. There were 2, one neurotic me and another attorney. No mask. I went out into the lobby, shoulder to shoulder, and I thought, and then they brought 60 kids in to observe, to learn about the jiu-jitsu, which is great under normal times, but then it's more than show. So I'm always a wreck. When I walk into a court, I look at everybody. Are they wearing masks? So what's the story? And it's ridiculous. It's not a healthy way to live. So now I finally said, whatever's going to happen is going to happen. Okay, our time is up. I hope you'll all come back together. Toni Troop of Jane Doe, thank you for organizing this. I know.
Thank you, and thank you for your support. June 14th is our Spring into Action event. We'll be honoring Rachel Rollins, the Office of Economic Empowerment. We're very excited, and please find out how to support ATASK and the Second Step. They need people's support as well to keep this work going. So thank you.
Sue Ross of Second Step and Dawn Sauma of ATASK. Put your credentials or your info in the chat, and Ian will run it. And if you have any questions, feel free to call me. And I can't thank you enough for the work you're doing and your hope. Attorneys don't have the hope that you 3 do. So I'm delighted to hear about hope. Thank you. Be safe and be well.
Thank you.
Thank you.